Hi guys, today we're talking psychosis. So what is psychosis? Psychosis is a symptom of serious mental disorders characterized by an impaired relationship with reality rather than a disease in its own right. They are a group of illnesses which disrupt brain functioning, which manifests as psychosis. A psychotic individual experiences things that no one else experiences and has beliefs which are not based on reality. Their thoughts, perceptions are disrupted, making it difficult for them to recognize what's real and what's not. These disruptions are often experienced as seeing, hearing, and believing things which aren't real or are extremely strange. They have persistent thoughts, behaviors, and emotions in keeping with these negative thoughts and beliefs. Psychosis can be frightening and confusing, and may also cause people who experience it to hurt themselves and sometimes to hurt others. So what's the prevalence of psychosis in the world? In the US, let's look at that first. Approximately 100,000 young people experience psychosis each year. As many as 3 in 100 people will have an experience at some point in their lives. Most of this will be first affected in late teens and in early 20s. Some people experience a brief form of psychosis which lasts only a few days or weeks, whereas some may experience a few episodes of psychosis only. Others experience psychosis associated with lifetime illnesses such as schizophrenia and bipolar disorder. Symptoms of psychosis. So there are 4 main symptoms generally associated with a psychotic episode. 1. A hallucination. A hallucination is generally a sensory perception and the absence of the actual stimuli. The person perceives something that doesn't exist in reality. They may occur, in fact, in all of the 5 senses: auditory, visual. So let's look at the visual. So from a visual perspective, sight, colors and shapes, or peoples and animals that don't exist may be seen. Sound-wise, voices that are angry, unpleasant, or even sarcastic may be heard. A common hallucination with regards to touch is that you feel you are being touched when nobody is there, or insects are crawling on your body. With smell, usually we'll experience a strange or an unpleasant odor. And with taste, some may even complain of having a constant unpleasant taste in their mouth. Another common symptom with psychosis is delusions. A delusion is a false belief or impression that is firmly held, even though it is contradicted by reality and what is commonly considered true. It is consistent with the person's culture. It is inconsistent with the person's culture, but what you'll find is that the theme is generally consistent with the person's culture. For example, if you're exposed to the internet, you'll find that's your common theme of delusions. Or if you're exposed to, in the old days, it used to be telephones, you'll find that the telephone was in keeping with the delusion. That means you felt that someone was calling you up all the time. And generally, as we may say, these things will be obviously irrational. A common delusion, for example, is paranoid delusions. And these may cause a person to be unduly suspicious of individuals, organizations, and they believe they are plotting or causing them harm. For example, refusing to be in the presence of a family member because they believe that family member wishes to poison them. We may even have delusions of grandeur, a clearly false, but a strongly held belief that you have some special power or authority. For instance, we may feel that we are a world leader or have the power to bring back people from the dead. We may in fact also have confused and disturbed thoughts. When acutely ill, people with psychotic symptoms experience disturbed, confused, or even disrupted patterns of thought. The everyday lives that let us live our daily lives become disjointed and nonsensical. Other signs that may experience is rapid and constant speech, disordered thinking, and we jump from one topic to another, making strange connections between the thoughts, and a sudden loss in our train of thought, resulting in abrupt pause in conversation or activity. We lack insight. We are completely unaware when psychotic that our behavior is in any way strange or that the delusions and hallucinations are not real. They may recognize delusions or bizarre behavior in others, but lack the self-awareness to recognize it in ourselves. For example, a psychotic person being treated in a psychiatric ward may complain that their fellow patients may be mentally unwell while they are completely normal. So, what then causes psychosis? We don't completely understand what causes it, not necessarily fully understood or clear. Each cause of psychosis is different. It's not currently possible to precisely identify who is likely to identify the illness of psychosis. However, we are learning more and more as to why it develops, and several factors are coming to the fore. One is genetics. Many genes can contribute to the development of psychosis, but because a person has a gene doesn't mean they will experience psychosis. Nonetheless, people are more likely to develop psychotic disorder if they have a family member, close family member, a parent or a sibling who has a psychotic disorder. Another common precipitant is trauma. A traumatic event such as death, war, sexual assault can trigger a psychotic episode. The type of trauma and the person's age affects whether the traumatic event will result in psychosis. A common one, more so nowadays, is substance use. The use of marijuana, cannabis, whatever you may call it, LSD, amphetamines, and other substances can increase the risk of psychosis, especially if you are vulnerable. However, it's difficult to determine who is and who isn't vulnerable when using substances initially. You never know who may develop it as a result of using substances. Another common factor that contributes to psychosis is physical illness or injury. Traumatic brain injuries, brain tumors, strokes, HIV, and other brain diseases such as Parkinson's disease, epilepsy, chromosomal disorders, psychosis, dementia, all may cause psychosis. Other mental health conditions. Sometimes psychosis is a symptom of a condition like schizophrenia, schizoaffective disorder, bipolar disorder, or even depression. Other mental illnesses that can contribute to psychosis, and the common ones are schizophrenia. Another one is postpartum, or also called postnatal psychosis. These are some of the mental illnesses that can also contribute to psychosis. We also have substance-induced psychosis, which can be triggered by the use of alcohol and illegal drugs. And these include stimulants such as amphetamine and cocaine. Hallucinogenic drugs such as LSD also cause people to see things that are not really there. Generally, we hope that these effects are temporary. However, regular use of these drugs can cause shifts in the brain, as we are discovering. And these are associated with drugs like cannabis. Steroids and stimulants can also cause symptoms of psychosis. People who are addicted to alcohol and certain drugs can also experience psychotic symptoms. And they suddenly stop drinking, that can also, in fact, also predispose to psychosis. We have an illness which we may attribute as brief psychotic disorder. Sometimes patients will experience what we call a brief reactive psychosis, and this generally occurs during periods of extreme personal stress, like a family member's death. Sometimes experiencing brief psychotic reactive psychosis will generally recover in a few days or in a few weeks, depending on the source of the stress. Bipolar disorder. When we feel high and positive, we may even experience grandiosity. They feel extremely good and believe we have some kind of special power. When depressed, the delusions will be of a negative nature and will be of like low self-esteem, or you feel someone is against you or trying to harm you. Again, there are various other psychiatric disorders, be it delusional disorder, major depressive disorder with psychotic features, or schizoaffective disorders. There are even the various subtypes of schizophrenia. These are the primary causes of psychotic symptoms. But psychosis can also be secondary to other disorders and diseases. So how is psychosis diagnosed? It is diagnosed through a psychiatric evaluation. This means a doctor will watch the patient's behavior and ask questions about what they're experiencing. Medical tests and x-rays may be used to determine whether there's underlying illness causing the symptoms. Treatment of psychosis. Research shows that earlier people experience psychosis. The earlier that people receive treatment for their psychosis, the better the longer-term quality of their life is. Treating psychosis involves medications and therapy. And the most common medications we'll use is antipsychotics. Symptoms of psychosis can be controlled with antipsychotics quite effectively. And these help reduce hallucinations and delusions and help people think clearly. In many cases, people only need to take, hopefully, antipsychotics for the short term rather than the long term to get these symptoms under control. Certain illnesses, though, like schizophrenia, patients may have to take medications for a long period in their lives. During the acute phase, a stay in hospital is often needed. In terms of maintenance treatment, patients will then go off into the community, and that's where they maintain their antipsychotics for a long period of time to prevent any further episodes or relapses to occur. Sometimes failure of medication does happen. Here it's very important again to go to the doctor and look at far more effective treatment. Lifelong treatment of schizophrenia may involve other interventions and support, and this includes the role of the family in their care. All psychosis-associated illnesses can be treated. Yes, it may involve very intense forms of treatment, but you can lead a reasonably normal life. Most patients' lives can return back to a normal way of functioning, or some may need treatment for a long period of time. However, it's very important that all of us seek help if you feel that they're struggling with psychosis. So until next time, we'll chat again. Bye.